Afternoon to the members of the New York Medical College family. This is our third online town hall meeting since the onset of the pandemic in the United States. Over the past few months, things have become routine in our lives, which most of us never imagined being routine. Rarely leaving our house, ordering groceries online, getting toilet paper delivered via online retailers, wearing a mask when we leave the house, refilling bottles of hand sanitizer from gallon jugs, only seeing our children and grandchildren on FaceTime or Zoom, teaching and advising students solely via online classrooms and email and telephone calls, interviewing faculty applicants by phone, fiddling around with green screens behind our chairs. Last week, in my family, we conducted a birthday party for my 1-year-old granddaughter with her perched on a high chair in front of a computer with members of the family from California to Georgia to New Jersey tuned in via Zoom. The 1-year-old didn't seem to mind and she smiled on cue for everyone, but it was a mixed happy and sad sort of occasion. My 2-year-old grandson went to day camp in Atlanta yesterday with a mandatory 3 pairs of clothes for repeated disinfection during the day. The idea of conducting infection control on a collection of terrible twos simply boggles the mind. Obviously, what I have just described are, in the grand scheme of things, frankly, relatively trivial inconveniences. Over 100,000 Americans are dead as a result of the virus. An unknown number are dead of heart disease or cancer or diabetes or other illnesses because people were too frightened of the virus and didn't go to the doctor when they should have. Many families have dealt with severely ill loved ones, many of whom spent weeks on ventilators. Routine vaccination rates for regular childhood diseases in the United States have plummeted because child checks are not taking place. This could lead to, for example, another measles or whooping cough outbreak. It will not be surprising for oncologists like me to see escalating rates of carcinoma of the cervix or breast or colon because people didn't go for their routine pap smears, mammograms, or colonoscopes when they ordinarily would have. Some governmental jurisdictions are, quote, reopening, close quote. Some of these jurisdictions are reopening not because the science and public health data says it's safe in the region. And we have all seen reports in the news of large numbers of people placed at risk, for example, by reopening a hair salon and the hairdresser being infected and then potentially infecting customers. We continue to see refusal of some public figures to respect health directives to wear masks in public places. We continue to see absurd recommendations for ineffectual drugs or the buffoonery of discussing countertop disinfectants as if they were intended to be inhaled as an antiviral. In recent days, Dr. Kadish and I have sent messages to the campus community by email, giving our thoughts on the causes and responses to a second pandemic. The demonstrations we have seen throughout the country following George Floyd's death. I now want to talk with you about that death in the context of today's town hall. George Floyd's death is the most recent in a long line of lethal and non-lethal violence perpetrated against Black citizens of this country. When I was a small boy, I already had a powerful interest in history. The medical students who have been through my history of medicine course will, I suppose, attest to that. My mother bought me a 20-volume set of books titled A Chronological History of the United States. I remember very, very clearly the entry for 1619. It showed a painting of a group of Black men bound in iron chains. The text said that in August 1619, the White Lion, a ship owned by the Earl of Warwick flying a Dutch flag, docked at Hampton, Virginia, with the country's first cargo of 20 enslaved Africans. The bloody stain of racism on American history began on that date 401 years ago. How could we ever do justice to the names of those killed as a result of that first act 4 centuries ago? If I recited the name of Mr. Taylor or Breonna Taylor, if I recited the name of Breonna Taylor, who was killed in my former hometown of Louisville 3 months ago, if I recited the names of James Chaney and Andrew Goodman and Michael Schwimmer, who were burned into my consciousness when I was a boy as the victims of the Freedom Summer murders of 1964, if I recited the name of a 14-year-old, Emmett Till, who was lynched in 1955, if I recited the name of the gunning down of Medgar Evers in 1963, if I talked about the Zoot Suit riots in 1943, with attacks on Latinos and other minorities by US servicemen and off-duty policemen and civilians, if I told you about a story of my home state, the Wilmington, North Carolina massacre of 1898, I could not do justice to naming all the names because, of course, most of the names of the victims are lost to history, or they are only reported to us as a slave, Michael, or a field worker slave, Letty. I cannot, no one can name all the names. Racism has been a gnawing ulcer of the American experience. It is why George Floyd and countless others have been torn from their lives and the comfort of their families. I am required by my surgeon as part of my postoperative rehabilitation from spine surgery to take multiple long walks every day. I was taking such a walk this morning and I stopped while walking and I thought, the town hall meeting sent out a request for questions about 10 days ago. All the questions came in. They were all prepared to be answered. Every single question is about the COVID-19 epidemic and its impact on the life of the college. All the deans and the directors and the vice presidents are going to answer these questions at the town hall. The whole program is about the COVID-19 pandemic, not the burning perpetual pandemic of racism. And the world is changing under our feet. Will people think that we are not cognizant of their pain about this second pandemic, that of racism and its lethal consequences? We are cognizant of racism and the pain being inflicted upon the Black and brown members of the NYMC family. We have been actively meeting to develop an action plan of what we can and will do better on our own campus and within our own family. New York Medical College cannot by itself rewrite 401 years of American history. What we can do, what we will do, is strive to do our part to change that part of the American experience within our grasp. We will do that. Our School of Medicine has proudly, in recent years, had the highest percentage of underrepresented minority medical students of any historically majority school in the United States. My belief in NYMC's past and future as a bastion against bigotry in health science education remains. We all of us, share the responsibility of being stewards in our generation of American democracy. A Philadelphia matron stood outside the Constitutional Convention in Philadelphia and watched the delegates who had been meeting in secret file out. This society woman shouted out, "What have you given us, doctor? What have you given us, Dr. Franklin? Yet another monarchy?" Benjamin Franklin stopped his walk and turned to the woman and said, "No, madam, we have given you a democracy if you can keep it." We must all, in our times, be stewards and protectors of a civil, peaceful democracy that continues on what I still believe in my heart, an ultimate upward trajectory where we shall all be judged by the content of our character rather than the color of our skin, as Martin Luther King said. I continue to believe, as Abraham Joshua Heschel taught, some are guilty, but all are responsible. I continue to believe what Mahatma Gandhi taught. The essence of the nonviolent technique is to emphasize liquidating antagonisms rather than antagonists. Well, I resumed my walk and I came home, and that's where you see me sitting now, and you see part of my house behind me. You can't make out the names of the books on my bookshelf, but I can tell you that I started researching and publishing articles on the history of racial discrimination in medicine starting in the 1980s. And there are volumes on my shelves over my shoulder about that topic. And you can probably see over, well, this shoulder, a portrait. It's my uncle Nathan Jacobs on the bookshelf. He wrote the New Jersey Supreme Court decision, which desegregated the schools of Morristown, New Jersey, and subsequently desegregated all of the public schools in New Jersey. My Uncle Nat was my childhood hero. But I bet, like you sometimes feel like you're talking to a wall. How many more people have to die before we expunge the collective stain of racism from the American experience? I don't know, my friends. I don't know. But I do know that becoming is still superior to being, and we must try to become better and do better. And for the team at the helm of NYMC, we will do so in partnership with the students and the faculty and the staff. I ask you, therefore, to please understand that when you hear subsequently in this town hall, when it devotes itself to the questions and answers that were posed about the COVID-19 dialogue, that is not entirely about how everyone is feeling. The dialogue about and the response to the innumerable deaths I have spoken about related to racism will continue on our campus. We will prepare a step-by-step program of areas where we can take concrete action in our curriculum, physical plant, and the administrative structure to address racism. The deans of the School of Medicine action items. When you listen to everyone subsequently in this town hall talking about COVID-19 and our response to it, understand that everyone is feeling pain. I have taken it upon myself to articulate this 1-hour session about that pain, and that more conversation and action will follow. Turning back to COVID-19 at New York Medical College, we have striven to carry on. Many good things have been happening. Our students have hurled themselves into the pandemic fight as volunteers in a myriad of ways. Our faculty has been the source of public information and medical education regarding the pandemic in the media and via continuing education programs. We have conducted an online commencement program and honors and hooding ceremonies. The historians among you will note that these programs included the graduation of our first class of dental students and our first MS in medical ethics. In the case of the dental graduates, the time interval from first serious discussion of opening a dental school until the graduating class was 7 years and 5 months. In the world of higher education, that is warp speed. Our Office of Graduate Medical Education triumphed in a series of reviews of its overall program. Full graduate medical education reaccreditation was granted to Metropolitan Hospital psychiatry and pediatric residencies. We have launched a new summer program in Jewish medical ethics for 2020-2021. Enrollment in the DPT, MS, and speech language pathology, PhD, DDS, and MD programs are either full or oversubscribed. And our other programs, it's still too early to tell where we stand regarding enrollment. The average DAT score of the entering medical students this July is at 21.3, the same as last year and very high. For the entering medical school class, the average GPA so far is 3.62, which is an increase since last year. And the average MCAT is 512, also an increase compared to last year. There's been a substantial increase in the average undergraduate GPA of the entering PhD students and the GREs of the speech language pathology students. Many of you will have noted that Governor Cuomo chose NYMC's Dana Road building as the site for his weekly press briefing a few weeks ago. Dean Nadler has forged new academic affiliations with Lincoln Hospital. For those of you with long institutional memories at NYMC, you heard me correctly, Lincoln Hospital and the Bronx VA Medical Center. Finally, and most importantly, a word now must be said in praise of our faculty and residents and administrators on the front lines in the fight against COVID-19. It is, of course, impossible to mention everyone, but I will take the risk of praising those working at Westchester Medical Center under the leadership of Michael Israel, Gary Brudnicki, Renee Garrick, Eddie Leibovitz, Anthony Costello, and Michael Kowitz, among others. Those working at Metropolitan Hospital Medical Center under the leadership of Christopher Roker and John Pellicone. Those working at Good Samaritan Hospital, Mid-Hudson Hospital, Castle Point and the Bronx VAs, St. Michael's, Hoboken, Greenwich, Wyckoff, and Lincoln hospitals. And our very own doctors Marisa, Monte, Calvo, and Laurie Solomon fighting the good fight on our campus. We salute all of you and all of those I failed to name individually. We have received many questions for today's town hall about the COVID-19 epidemic, and we will cover those issues many of you are concerned about in reasonable detail. But first, you'll hear from Dean Robert Ambler on his overall thoughts on the state of the COVID-19 pandemic, and then we'll get to the individual questions. My dear friends, my dear young doctors, my dear young biomedical scientists and speech language pathologists, all the members of the NYMC community, take good care of yourselves. Godspeed on our journey together. We will all see better days ahead.
Thank you, Dr. Halpern. I'm Dr. Robert Ambler, Vice President for Government Affairs and Dean of the School of Health Sciences and Practice. I was asked by Dr. Halpern to give a quick update on the COVID virus, since I'm also a former CDC doc. First of all, the COVID reports in New York are in decline, and probably the best examples are the hospitalization reports and death reports, because those metrics are somewhat more reliable than simply case reports, which are based on the vagaries of testing. So with the decline in cases, many parts of New York State are in fact opening up. Our own region, which is called Mid-Hudson, is now in phase 1 of reopening, which is a good start. It does not affect our campus that much because it mostly affects outdoor activities like construction, forestry, and agriculture. But we are looking forward to a phase 2 of reopening in this region, which, although it has not been announced with a specific date, looks like it will probably come in a couple of weeks or maybe just a little bit longer. The significance of phase 2 is that it will allow, under proper protective plans and proper precautions, it will allow us to begin to reopen some of our offices, some of our departmental offices and back offices, and one can even imagine some of our faculty coming back into their offices on a staggered work week basis on different days and so forth. This is not yet guaranteed, and it's dependent on the continued reduction in cases in the area and on the site-specific business reopening plan that our deans and our vice presidents are working on right now to submit to Dr. Halpern and Dr. Kadish for final approval. So nothing is a done deal yet, but we can at least think about a light at the end of the tunnel to begin to reopen parts of our campus. I may talk about that more when we get into the question and answer period. Now, New York City, where we also have a significant presence, is the last region in the state to get to phase 1, which will start only next Monday. And New York City, of course, was truly the epicenter for the cases in New York State, which in turn was the epicenter for the nation. So everyone's going to be watching New York City very closely as these reopening plans get implemented. So the key principles, as some of our campus functions improve, will be to protect against exposure, to monitor everyone's health status along the way, and to rapidly identify and isolate any people in our community if they get sick. Remember that a second wave is also possible, and subsequent waves are also possible. So maintaining vigilance and care will be essential, at least until we begin to get the pharmacological solutions, such as medications that can treat or at least lessen the severity of illness, and hopefully, eventually, a vaccine. Finally, we should make mention, as we alluded to at the last town hall, that we have more information now about a serious pediatric syndrome that, although is rare so far, it does appear to have some association with COVID infection. Not firmly established yet, but enough of an indication time-wise that it could well be a complication of COVID infection in children and teenagers. This infection mimics a disease called Kawasaki syndrome, which also is rare. But so far, it's been reported with over 100 cases in New York State, several cases out of Maria Ferrari Children's Hospital, and at least one death reported so far. That's the current status of COVID right now. Reasons for cautious optimism. And I now have the pleasure of introducing Dr. Jerry Nadler, who is Dean of the School of Medicine.
I was asked a question. This is Dr. Jerry Nadler, Dean of the School of Medicine, and I was asked a question that I will read now. I am concerned about the status of the board exams for the medical students. What is happening with the clinical 2S exam at step 2, 2S? Will the Prometric sites be doing any testing for clinical 1 and 2 exams? I had heard that Brown in Rhode Island and a school in Florida might have regional testing centers. What will happen for the New York area medical schools? This is a very important issue, and I'm glad it was asked. Has created a lot of stress for our students. It's one of the other issues that we've all been dealing with during this pandemic with COVID-19. I've been on weekly calls with the Council of Deans of the medical schools, and the Vice President of Licensure at the NBME has provided regular updates of these issues related in particular with USMLE exams at the Prometric sites due to the COVID-19 pandemic. There are actually 3 regional testing sites already established and 2 additional ones. The 3 regional testing sites are housed at Brown, which is the New England site in Rhode Island, serving that region, the Midwest site at University of Indiana, serving that region, and the South site at Florida at University of South Florida. This is creating opportunities for 2,200 seats per month for medical student testing. In addition, starting actually next week, there'll be 2 additional sites, one in the Southwest at Dell University at UT Austin, Texas Regional Center, and the Western Center housed at UCSF. Those are already coming online. These 5 sites will bring a total of 4,000 seats per month for students. They will serve the medical schools in their region, but because of extra capacity, they will open it up to other medical schools. There are more regional sites planned, and I'm hoping one of them will be in the New York region. However, there's also a phase 2 plan that is literally coming online, hopefully soon. These are event-based tests, step 1 and step 2, CK, which will be done at the medical schools, and the medical schools can proctor them locally. A survey was actually literally sent in this week by our medical school to hopefully become a testing site for step 1 and step 2 CK. More to come on that, and we will provide regular updates in town halls to our students, as well as I thank our deans, Dr. Kessler, Dr. Ponterio, and Dr. Racklin, who will be keeping updated information for our students there. Now, step 2 CS, that's a major issue. That is on suspension for 12 to 18 months. The reason why it was put on suspension, as you suspect, it's very hard to do in-person performance-based exams during this pandemic. So the step 2 CS will not be happening for the next 12 to 18 months, and it's unclear how it will come back. Now, this will not hurt our students going into residency because residencies understand that the step 2 CS will not be able to be accomplished. So I want to thank you for a very important question, and good afternoon.
Good afternoon. My name is Salman Amar. I'm the Vice President for Biomedical Research at New York Medical College, and I've been asked to provide COVID-19 state of the research at the New York Medical College, especially on the work associated with vaccine development here at New York Medical College and any other projects related to COVID-19 research here at New York Medical College. So in regard to vaccine development, I, I can tell you that within the New York Medical College, no one is working on the vaccine. However, we have, with our affiliate hospital, we have been asked to provide feasibility studies in regard to a potential work on testing a vaccine within the hospital population that we have. These are preliminary discussion, and hopefully we will be reporting to you later on. In regard to coronary COVID-19 research at New York Medical College, there are a few projects. We've been extremely fortunate to be participating at different stages and different level with our partners. The first one is, as you probably know, New York Medical College, in conjunction with one of the affiliate hospitals that we have, has coordinated a multi-center clinical trial testing the effect of an anti-cytokine, specifically for the cytokine storm that we see in advanced cases of COVID-19. And you should be hearing within the next months or probably in the summer with results associated with this clinical trial. Recently, some of the sponsors that approached us to look at investigating the immune response. As you probably imagine, COVID-19 triggers a significant, a huge and massive immune response that is becoming now a template for many molecular immunologists to understand how the host responds to massive infection. And we've been asked to participate in understanding the immune response of infected patients in hopes of defining the parameters associated with the function of human antibodies towards COVID-19, and most importantly, whether those antibodies are going to be neutralizing anybody. You will hear by Dr. Monte Calvo later on an interesting project associated with salivary testing on COVID-19. And finally, another project that is in heavy discussions right now is preliminary discussions on COVID-19 effect on the gut microbiome. So we've been extremely fortunate to participate with those projects, allowing us to continue the research that we've been doing, as well as strengthening and demonstrating to our partners that we are part and parcel of this project, that we are strongly involved into the defining the parameters for vaccine, for treatment, as Dr. Ambler was mentioning this, and we look forward to providing you with success stories associated with COVID-19 at New York Medical College. Thank you very much for your question, and have a wonderful afternoon.
My name is Adam Hammerman, and I'm the Vice President and Chief Financial Officer here at New York Medical College. I've received the following question. Mr. Hammerman, can you share your views on some of the questions on my mind regarding the plans for reopening the campus? Is there a date that's been determined when employees not working in the research laboratories can return to campus? Will common areas like bathrooms and kitchens have restrictions on usage? And I'm also concerned about Skyline. Will it be possible to open the windows? Thank you for your question. And I know this is something that is on the minds of many. New York Medical College is committed to the health and safety of all students, faculty, and staff, and therefore is not only weighing all state guidance and regulations, but is also making sure we do our best to not take any missteps and potentially and unnecessarily place people in harm's way. While not ideal, I am happy to report that most back office functions have been running effectively even during this time of working from home. Of course, there are a handful of people for whom his or her essential job responsibilities necessitated them working on campus periodically, and we were sure to do all we could to accommodate. NYMC has been working closely with representatives from New York State to plan for the eventual and gradual reopening. As many have been notified, we have already been able to start opening various laboratories. This has been coupled with increased monitoring and area restrictions. While we do not have any specific dates yet, we do know that every day the governor is announcing progression for certain counties to move from phase 1 to phase 2 and so on. As of now, we anticipate the gradual reopening to start soon and continue over the summer months. Of course, we plan to keep communication flowing with all details regarding office openings, physical distancing, protective equipment, hygiene and cleaning, screening, and various restrictions, such as office kitchens, conference rooms, and which bathrooms will be open or closed. We are preparing policies to post as soon as possible. I would like to take this time to reiterate, if you or a member of your team needs access to the campus or a specific office or offices, please email Sarah Carter and Velma Borden with a copy to your supervisor detailing the date, times, and locations where and when access is needed. We will be sure to do our best to accommodate within the policy restrictions. As for opening the windows in the 19 Skyline Drive building, unfortunately, that is not possible without redesigning the building. However, I can tell you that the HVAC systems are being maintained and cleaned, and general cleaning and disinfecting is happening throughout. As I stated before, NYMC is committed to the health and safety of all students, faculty, and staff, and therefore will make sure all proper steps are taken to ensure such. Thank you for your question.
This is Dr. Robert Ambler again, and I'll read the question that was sent to me. Dean Ambler, can you provide an overview of your thoughts on how we go about deciding when to resume face-to-face classes on campus? Well, yes, I can provide you an overview of my thoughts, but understand that we have a task force in place made up of the vice presidents and the deans reviewing exactly these kinds of issues, similar to what Mr. Adam Hammerman just outlined for you on some of the other aspects. We will then pass those recommendations on to Dr. Halpern and Dr. Kadish for a final determination. Now, understand that for all of us, the real dream, the real objective is to get to the point where we can resume classes, face-to-face interaction, clinical encounters, all of the things that make us great as an academic institution and a place of education for everyone. So this is a very important goal. And in many ways, it's the ultimate goal for our task force and for our campus. I would say, if you want my thoughts, and these are just mine, that bringing students back into class in a face-to-face environment is comparable in some respects to reopening dining rooms and restaurants and larger events, gatherings, banquets, weddings, and so forth. And that sort of flies in the face of the need to block exposure from this virus. So, from a public health epidemiologic point of view, we're going to have to make sure that we are not allowing more exposure between people when we take those steps. And so if you follow the general guidelines that are now being put out in the news for reopening of restaurant dining rooms, you can see an analogous situation. People sitting closer to each other, people potentially being exposed to the mist from each other's breath, and that is potential exposure. The whole goal here is to block exposure everywhere we can. If we look at the state guidelines, this reopening phase will be phase 4, which is still another 4 to 6 weeks away at a minimum in terms of restaurants. And again, we will need to look at this at the campus level to see what we need to do here to keep everybody safe and free of exposure to the fullest extent possible.
Good afternoon. I'm Dr. Ronnie Myers, Dean of the Toro College of Dental Medicine, and I have been asked to answer the following question. Will there be building modifications for employee safety at the Skyline building designed to limit the traffic flow of dental patients and family medicine patients in inner office hallways? And can the inner doors in the building be closed to limit patients wandering throughout the building? So thank you for the question. The Skyline building is a 250,000 square foot facility on the far western edge of the campus and is home to a significant number of employees of New York Medical College, the Toro College of Dental Medicine, and not to mention students and patients. Prior to the COVID pandemic, upwards of 2,000 people utilized the building on a daily basis. Plans for the operations of the building to limit, organize, and socially distance traffic are being developed. And as has been mentioned, a task force has been put together of all the deans on the campus to look at all the buildings. Plans for the operations of the building to limit, organize, and socially distance are being developed. And these plans include increased hand hygiene stations, daily screening, limiting access to the building on a scheduled basis, signage and directing individuals within the building, including up and down staircases, along with ensuring PPE compliance on entry and utilization within the building. In regard to patients within the building, who will also comply with those items I've just mentioned, they will be instructed to wait in vehicles until appointments, have only one building access point, be screened upon entry, allowed limited access to the elevator, and be provided a mask if they do not already have one. Unfortunately, inner doors within the building are fire doors and cannot be closed to limit patients wandering, but signage within the building will be clearly marked for patients just as employees, and patients will, just as employees, be screened upon entry and required to wear masks. On a side note, repairs on the main elevators, which people have been asking, have resumed, and it is our understanding that the project is still on track for completion early in the fall. Again, I thank you for the question.
Hi, I'm Sarah Cotta, Executive Director of Facilities Management, Capital Planning, and Environmental Health and Safety. I've been asked to answer a few questions about how the college is implementing health and safety and infection control procedures during our reopening process. The first question is, as a part of the college's reopening plan, will we need to have our temperature taken daily when we come to work? The answer to this is yes. Per New York State requirements, we will be verifying both temperature and requiring a health attestation from all individuals on campus each day that they're on campus. This applies to faculty, staff, students, contractors, and all visitors. We are implementing an interim procedure for doing this later this week. Details will be shared through a community email. And as we update the process, we will keep the community informed of any change. The next question is, what do we need to know about the requirements for wearing face masks on campus? So yes, we, in accordance with New York State policy, will require all individuals to wear face masks while in common areas and when they cannot achieve 6 feet of social distancing. The follow-up question is, if I don't have a face mask, how can I get one? So in order to ensure that all community members have access to reusable cloth masks, we have set up an internal procurement and distribution center that we call the stock room. So inventory and pricing for everything available through the stock room, such as disinfectants, reusable masks, cloth, disposable masks, hand sanitizer, and other personal protective equipment, can be ordered by sending an email to nymc @nymc.stockroom at nymc.edu. Please provide an account number and mailroom personnel will fulfill your order through contactless delivery within 3 days. Additionally, all students that will have a campus presence will be provided with a student safety kit. Each safety kit will contain 2 reusable cloth masks, a thermometer, hand sanitizer, and disinfectant wipes. The final question is, I have read that some workplaces are going to install plexiglass barriers or clear plastic curtains in offices. Others are putting in 6-foot distance markers or requiring one-way traffic in specific corridors. Some will have hand sanitizer stations at the doors. Are we going to do things like this? Yes, thank you for asking. So with regards to hand sanitizer stations, these have already been implemented. Any space that requires such, please send an email to NYMC Stockroom. Additionally, we are ensuring that all bathrooms and sink areas are supplied with soap and paper towel for good hand hygiene. And then in other areas that require social distancing, we're assessing the need for plexiglass barriers, social distancing marks on the floor, etc., so we can ensure that all areas are safe and compliant for the gradual return of personnel to campus. So thank you so much for these questions. And as always, feel free to reach out to me directly with any questions or concerns. Stay well.
Hello, this is Nicholas Janica, Vice President and Chief Legal Counsel for the college. I was asked, how does the college plan to bring back furloughed workers? Can you tell us anything about the plans for workers who had their number of work hours reduced because of the pandemic? Staffing is ultimately determined by the pacing of our gradual return to full operations. Positions were furloughed due to decreased work in certain areas of the college in connection with COVID operational changes. As campus activity decreases, department leadership will work with their respective dean or vice president, who will coordinate with the college finance office and human resources staff. Human resource staff will coordinate recall communications with furloughed employees and other appropriate parties. New York State directives require continued social distancing to the maximum extent possible, even during the multi-phased reopening. The intention is to stay below 50% simultaneous campus occupancy for the foreseeable future. New York Medical College intends to be very, very cautious about increasing campus activity for the safety of our faculty, staff, and students. As Governor Cuomo has said, we need to maintain flexibility and be prepared to take steps backward if deemed necessary due to public health outcomes. Consequently, we do not envision a return of the volume of work associated with significant campus activity for some time. Whatever the new normal will be, we do not expect New York Medical College to attain that normal until sometime after Labor Day. In the meantime, we want everyone to stay safe. Members of the college community should continue working remotely and with modified campus presence. I encourage everyone to take comfort in the resiliency of the human spirit and know that even though we may be physically distanced, great work continues at New York Medical College. Thank you.
Hello, my name is Marina Halls, Dean of the Graduate School of Basic Medical Sciences. Before I answer my town hall question, I would like to address the current events that started last week in Minneapolis and spread across the nation. I want to address our Black students and colleagues here at New York Medical College. I see you and your pain. Please don't hesitate to tell me how we can make this community a safer place for you. Now to the town hall question. I've been asked the following. Some research laboratories were not included in phase 1 of reopening. Will there be the opportunity for those laboratories to open during the next phases of reopening? Will there be an opportunity for individual laboratories to discuss arrangements for maintaining some level of activity as we move forward, including space and equipment setup accommodations? Thank you for this important question. As you know, phase 1 lab reopenings started last week, And we are hopeful that in this phase, everybody will adhere to the safety protocols established by New York Medical College, as well as by individual labs, and that we will remain safe. The capacity to add additional labs to operate in phases 2 and forward will depend on our ability to support these labs, which will depend on the situation in the county as well as the state, and the operational capacity here at New York Medical College. So the answer is yes, we will absolutely consider adding additional labs if the situation permits it. Thank you.
I'm Dr. Marisa Monte Calvo. I'm an infectious diseases physician here at New York Medical College, and I serve as the medical director for health services. I was asked to respond to the question, what is the status of research on using saliva for COVID-19 testing? So that's an excellent question, and I'm glad it was asked. Saliva is a very attractive specimen for diagnostic testing because of the ease of collection, and certainly more comfortable than having a nasopharyngeal swab performed. However, at this moment, it remains under research, and with the exception that there are a couple of laboratories that have received emergency use authorization by the Food and Drug Administration to perform COVID-19 diagnostic testing on the salivary specimens. In New York State, the New York State Department of Health still advises a nasopharyngeal swab as the preferred specimen for diagnostic testing. However, under situations where a nasopharyngeal swab cannot be performed, it is acceptable to use saliva in combination with a nasal swab. A nasal swab is a swab that simply enters the first sonometer of the nose and the swab is rotated to collect the specimen, in contrast to a nasopharyngeal, which goes much deeper. So saliva in combination with a nasal swab can be used under situations where a person is self-collecting but observed by a healthcare provider. I am hopeful that with this possibility that there will be results forthcoming regarding the results of the saliva in comparison with the nasal swab, and through research trials in comparison with nasopharyngeal specimens. So it's an excellent question, and I thank you for it. And at Health Services, we look forward to seeing people return carefully and cautiously. And although the numbers will be fewer, we will look forward to serving you. Thank you.
I'm Dr. Richard McCarrick, Vice Chancellor for Campus Student Services. I've been asked to address the accommodations that have been made for our on-campus housing as a result of the COVID pandemic. And specifically, I was asked to explain what arrangements were made for students who asked to leave student housing in Valhalla early because of the pandemic, and what provisions are in place for students who want campus housing but will be coming to campus later in the academic year because at the start they will be taking online classes. The New York Medical College Office of Housing and Residential Life has made a number of significant changes to accommodate the needs of our students during the pandemic. First, we allowed all of the continuing students who are currently living on campus housing and wish to remain on campus to renew their leases for next year. This was a change from past practice, which limited renewals for students in certain programs. This change was made in collaboration with the deans of the relevant schools and was intended to minimize housing disruptions for our students during this difficult time. Second, we delayed housing reservation cancellation deadline. We did this twice for an entire month to allow students more time to decide if they wish to stay on campus or come to campus next year. On a case-by-case basis, we are still considering requests for cancellation of housing reservations for students whose circumstances have changed. Third, we granted early termination of leases for students who wish to leave campus housing either due to early graduation or because of the transition to virtual education. Most of the housing leases run through the end of June, but we started granting termination as early as April 15th for graduates of the School of Medicine who graduated early, and we've continued to grant terminations in 2-week intervals to meet the departure schedule of students who are moving off campus. As of today, 78 out of 500 of our student tenants have taken advantage of this early termination opportunity. Next, we agreed to hold housing reservations for students in certain programs that begin in June, July, or August, but who will not be arriving on campus at that time because of online education. They will be arriving later in the year when in-person education is either required because of the nature of their program or because in-person education has resumed. We will not be charging rent until the students actually arrive and occupy their apartments. Last, we are keeping a number of apartments vacant for potential use as isolation units if medically necessary for some students living in campus housing. The use of these isolation units will be with the approval and under the supervision of the Student Health Service led by Dr. Monte, who you just heard. Finally, on behalf of myself and the staff of the Student Housing Office, Catherine Smith and Madeline Makings, we appreciate the opportunity to continue to provide housing on campus for our students in an environment that we hope is convenient, congenial, and safe. Thank you.
Hello, my name is Velma Borden, and I am the Chief of Staff at New York Medical College. I received the following question. What are the plans for on-campus food services in the coming academic year, and when do you think the cafeteria, Starbucks, and Skyline Cafe will reopen? Thank you for your question. We anticipate opening the vending machines, Doc's Cafe, Starbucks, and Skyline Cafe later in the fall semester. When we reopen, you can expect some modifications to seating capacity, distance between tables, serving of food, and grab-and-go items. Note, you will still be allowed to bring in your own food. This is an important step in supporting safety and in addition to instituting appropriate cleaning and disinfecting procedures. Note, all cleaning will be frequent, especially in common areas. If you have concerns or additional questions, please send me an email. We look forward to seeing you soon. Thank you.
Hello, I'm Jennifer Rickert, Vice President of Communications and Strategic Initiatives, and I've been asked the following question. Is it true that the Middle States reaccreditation visit for the college has been changed from taking place in person to being done virtually? What does that mean, and what do we have to do? Thank you for your question. We have a preliminary visit on September 14th and 15th of this year with the chair of the reaccreditation team, and we have been informed that this will be done virtually. During this virtual visit, the chair will give leadership and the working groups feedback on our draft self-study. As for the full reaccreditation visit, organizations that have been scheduled for visits in the fall of 2020 will be done virtually. But even then, there will be a mandatory in-site visit by multiple members of the reaccreditation team at a later date. New York Medical College's reaccreditation visit is scheduled for spring 2021. At this point, this visit is still slated to take place in person. However, if this changes, we will notify the community and plan for a virtual visit accordingly. Thank you for your questions. We will continue to keep the lines of communication open. This concludes today's town hall meeting, and we hope you have an enjoyable afternoon. Thank you.